asking me that many time one of the case scenario I will be giving you. One psychiatric case came in Colombo exam in 2024. The patient was keep on walking in the room. Okay. Now, patient was keep walking on the room. He was not sitting. He was not following the commands, and he was not willing to listen to the doctor. So that was a quite unusual situation. Patient was schizophrenia. Okay, we call it, that is a red alert kind of thing. Here, how to deal with that patient is very tricky. So, this kind of cases, if you are getting in the exam, so it will be quite tricky for you. How you don't know how to take the history from that fellow. So, how to calm down that patient. That is again win-win situation for us everyone. Actually, how to deal with that patient. So, we have to keep in one thing in the mind that those patient also the regular patient where you will be getting going through that one. Only the thing you have to show that how to build a trust. Okay, here what you are going to see. First of all, you're going to conduct a structured, empathetic mental health assessment. Okay, formulate your risk and diagnosis and plan safe. Plan safe not only the patient, doctor, and your not only the patient, on doctor and surrounding people also, and collaborative management. Okay, and this is mostly focused on how you're going to take the psychiatric history. Okay, and elements of mental health state examination and risk assessment and high quality communication with the patients and carer. Most of the time, you will be getting only the patient. Okay, and here many times you'll be getting the patient alone himself. Mostly they will be getting with postnatal depression, post-MI depression. These are the pediatric so small cases we used to get in our exams. But now they've specialized a little bit more into that one. They started giving you schizophrenia. They started giving you some sort of some serious cases with some sort of acute mental disorder kind of thing. So here, give me 1 minute, doctor. My is not on. How are you going to get the situation? Say this patient, for example, the patient come with some sort of cycle, how to assess that one. Okay, so here we are going to assess the ability of the candidate, like say for ourselves, how we are appear, how our appearance and how we are behaving with the patient, with our gentle speech and mood and effect. You have to calm down the patient. Uh, you have to see that how you're going to see them. For example, if patient having suicidal or homicidal ideations are there, or delusions are there, or obsessions are there. So how you going to see? Sometimes patient will be sitting in front of you and say, "Doctor, look, that from the Mars, this fellow is coming to me. He's going to kill me. Doctor, save me!" And he will try to hug you. What you will do in that situation? You have to calm it down. Okay, situation, that's the most important part. Now, cognition, how patient's orientation and attentions and memory. Many times patient will be talking about the memory which is near past, maybe sometime which is not existing on this world. Also, they'll be talking about and insights. Okay, here for the candidate, sensitive exploration of psychotic mood, anxiety, and substance use and risk-related phenomena, and mostly we are maintaining the report. This case is bit difficult and tricky than other cases, like say, for example, in your in medical, like say, in the medicine, we are talking about cardiology. It will be totally different. Here, patient will be depressed. Patient will be having some sort of problem, but patient will not be able to tell you what's going on with him or her. Okay, so here, what you are going to do it, you are going to build a rapport. It's not simply that, oh, what happened to you, what happened. Patient will be telling you some sort of stupid thing that you don't understand what he is telling. So, Dr. Sumera, your patient is with me.
Yes.
Um it's Mr. Ahmad Khan. He is a 35 years old gentleman, and he came to discuss with you some problem. So, take proper history and manage the patient. Examination is not required. Doctor, give me 1 minute. My headphones are not working. I have to get some other one.
Okay, sure.
So, doctor, am I audible now?
Yes, doctor.
Okay. So, Mr. Ahmad Khan, 35 years old gentleman, he come to discuss his problem with you. Take proper history and manage the patient. And um, examination is not required. Okay.
Okay, should I start?
Okay, doctor, start.
Hello, Mr. Ahmed. My name is Dr. Sumera. Please tell me what brings you here today.
Doctor, I have just not been myself lately. I'm getting worried about so many things, doctor.
Mm-hmm. Okay, Mr. Ahmed, please tell me more about it.
Doctor, it's been now 6 weeks. Most of the time in the morning time, doctor, I feel that uh, I don't feel myself into the moods. And but as the time passed by the evening, I feel better, doctor. And
Mm-hmm.
I don't want to play with my children, and I don't like to go outside, doctor. I don't know what's going on with me, doctor.
Okay, I'm sorry to hear about it that you're feeling like that. Mr. Ahmed, please tell me, just 6 weeks back, you were totally fine.
Yes, doctor, I was doing everything well. There is no such thing, doctor.
Mm-hmm.
But yeah, doctor, there was nothing such thing changed. Nothing happened to me, doctor. But I don't know. Suddenly, I lost my everything.
Okay, so tell me that I want to ask you a few questions. Is it okay with you?
Sure, doctor.
Okay, please tell me that do you feel low most of the time, most of the day?
Yes, doctor, I feel low most of the day and mostly a tired feeling. I can't concentrate, doctor, at my work. I'm
Mm-hmm.
making a lot of mistakes, doctor.
Oh, okay. And tell me, have you lost interest in things which you used to do?
Yes, doctor, I told you that I used to play with my children. I used to go with friends out, but I just stopped enjoying these things.
What about your sleep?
Well, doctor, it's very difficult to sleep. If I'm getting sleep, for example, I wake up early morning 4 a.m. I can't go back to
Okay,
sleep.
sorry to hear about it. And what about your appetite?
Well, doctor, that one also reduced. Even though I lost my weight, doctor.
Oh, okay. And what about, do you feel worthless?
Yes, doctor. I'm feeling nowadays because since my new manager
Okay.
joined,
Mm-hmm.
um, I don't know. He's a cranky person. I don't know why he's having some grudge with me. I don't know what's wrong with him. And I feel now I'm no more worth in my company.
And have you ever thought of harming yourself or any suicidal thoughts?
No, doctor, I never planned out that one because, but I feel that worthless. Some days, doctor.
Okay. Mr. Ahmed, I want to ask you a few more questions. Like, do you have any history of any psychiatric illness in the past?
No, doctor, I'm really healthy person. I never had such kind of thing. I never went to doctor for any reason.
Mm-hmm. That's good. And in your family, is there anyone has depression, history of depression?
Doctor, my mother, she had some sort of, some nerve
Mm-hmm.
problem. She was taking some medication.
Mm-hmm.
And that time I was very young, well, maybe 10 years or 12 years. She used to take. Someone told that my mother had some sort of brain issue.
Okay. Okay. And how is your mother now?
Doctor, she passed away when I was 15.
Oh, sorry to hear about your mother. Okay, and tell me that. Okay, one more thing. Do you hear some sounds that others don't hear,
No, doctor, I don't have.
or do you see anything which others don't see?
No, doctor.
Okay. Are you using any medications on a long-term basis?
No, doctor.
Okay. Do you have any long-standing illness?
No, doctor.
Do you have any history of hospitalization?
No, doctor.
What do you do for your living?
Doctor, I'm an accountant.
Accountant. Okay. So you have stress at work?
I told you, doctor, I nowadays I have stress with my manager join.
Mm-hmm. Okay. And what about your with whom you live?
I'm living with my wife and two children.
And everything fine at home?
Yes, doctor.
And do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
Okay. And you said that you are sleeping less these days, and you are eating less also.
Yes, doctor.
And is there any weight loss
Yes,
these days?
doctor. I lost 3 kilo weight, doctor, if I'm not eating.
Mm-hmm. Okay. And what about your like? Do you take coffee, caffeine?
No, doctor. I just taking coffee tea morning time only.
Mm-hmm.
Yes,
Okay.
doctor.
Okay. Tell me that what is crossing over your mind?
Maybe I'm just weak or lazy, doctor. Something wrong with my brain.
Okay. And what's this thing worrying you the most?
Doctor, worry maybe I will be losing my job because of this manager, doctor. I am the only one bread and butter earning for my family.
Mm-hmm. I hope not. Okay, and we will see about it. And what are you expecting from me today, Mr. Ahmed?
Doctor, I just wanted to know what's wrong with me.
Mm-hmm. So definitely this condition is impacting your daily life. Okay, so much. Okay.
Yeah, doctor.
And so you told me, so let's summarize that you told me, Mr. Ahmed, that you are saying that you are not feeling yourself, you're worried since the last 6 weeks, and
Mhm.
that you are feeling low mood and you are feeling worthless sometimes also. And are
Mhm.
feeling that you are weak and you might lose your job because of this, and you want me to do something for you for that.
Yes, doctor.
Okay. So, Mr. Ahmed, on the basis of your history, I feel that you are having a symptoms of depression. Um,
Okay, doctor. So, doctor, it's
um,
dangerous that I will be going to mental hospital, doctor.
no, Mr. Ahmed, don't think like that. So, I am just okay. I will tell you. Do you know what is depression?
No, doctor.
Okay, so Mr. Ahmed, every person feels ups and downs in their life. But when these things affect so much your daily activity, your routine, and you're feeling that, and if you feel down most of the time, then these are the symptoms of depression. What you have told me.
Mm-hmm.
So it can be genetic. It can be there are many factors of it. Are you getting me?
Mm-hmm. What is genetic, doctor?
Okay, so meaning that if someone in your family, like your mother, your siblings, your father, has history of these kind of symptoms, so these things runs in the family. Are you
Okay,
getting me?
doctor. Okay, doctor.
Okay, so Mr. Ahmed, don't worry. I am here to help you, and I am here to guide you. So what we can do is that we can. I can recommend you some lifestyle modifications, like try to do some relaxation exercises. Can you do that?
Okay, doctor.
Try to walk daily if whenever
Mm-hmm.
you get time. Okay, and I will give you some leaflet regarding your condition, and I will recommend you some social support groups that will
Mm-hmm.
help you regarding this. And I will
Mm-hmm.
also recommend you one talking therapy. Can you? I can refer you to a psychologist for that. Is it? What about that?
Okay, sounds good, doctor.
Okay, and if I can recommend you this is called the CBT talking therapy for the 3 months. If your condition will not improve this with the CBT, we can also give you some medications like sertraline, which is 50 milligrams once a day. But the thing
Mm-hmm.
is that these medications has some side effects like they can like acidity or like weight gain.
Mm-hmm.
Okay, so
So,
I
doctor,
can recommend you that.
it will work immediately, doctor?
No, no, it take 12 weeks to work. Okay, so and you
12
have
weeks,
to take,
doctor?
yes, 12 weeks.
Okay, doctor.
And but meanwhile, I will recommend you CBT. So CBT will work. So okay, and that one more thing is that, Mr. Ahmad, if you ever feel low, if you ever have
Mm-hmm.
suicidal thoughts, okay, so
Mm-hmm.
in
Mm-hmm.
that case, you have to come emergency, or you have to come to
Mm-hmm.
me. Okay,
Okay.
and
Okay, doctor.
meanwhile, one more thing is that you have to come to me after 2 weeks.
Mm-hmm.
So and I hope you will be fine. And
Mm-hmm.
regarding your job and things like that, I think these things will improve, and you will not lose your job. And we have social services also, which help the person with the finances. So I will also
Mm-hmm.
recommend you to go. Recommend you. They will social worker and social services.
Mm-hmm.
So do you have any other questions or concerns?
No, doctor.
Okay. Thank you for your visit. And if you
Okay.
feel anything, if you want to ask anything, you can come to my clinic anytime.
Okay, doctor. Okay, Dr. Sumera, you are clear pass because why I'm saying this is a clear pass because this whatever it was needed in this one, you addressed and you gone through. I like it, but few things I wanted to say because what was the time wasting in that exam and in the data gathering, and there was a double questions and repeated questions were there. Okay, summary was longer, and you should not use medical jargons, and don't ever say "don't worry."
Hmm. Okay.
Okay, we call it pitfalls in in management, pitfalls in management. As per MRCGP UK, MRCGP South Asia, and all MRCGPs, they said that if you are giving wrong hope to the patient, it will be, it will not be, it will be impacting your whole scenario. Second thing, doctor, onset of the benefit will be 2 to 4 weeks rather than 12 weeks, doctor. Okay, 12
Okay.
weeks too long. Okay. And why I say that you gone through because you had a structured history. Structured history, few things you have to add on. You have to start from like say this kind of question. Start from the mood. Okay. Fair then social activities, patient sleep hygiene, patient appetite, along with patient already mentioned about this one. About guilt. Okay, guilt is again more important here. Okay, patient don't have any clear trigger except he is having some manager issue. So you have to explain that, Mr. Ahmad Khan, what I'm suspecting that you are worried about and your problem is related to your job. Okay, are you getting me? How it is related to your job? Now here, what you're going to say about the patient rather than apart from giving this medication style also that you can see that um, um, you have to talk to your manager or to your superior and you have to solve the issue what's going on with you. It is a solvable because whenever we are working in the same working environment, there is a possibility that we have conflict of interest or some sort of what you call it misunderstandings are there, so you must clear it. Okay, at the point, I'm not seeing any trigger in your case, and otherwise shall we manage this management plan? But again, doctor, one of the most gold standard question, let me tell you, it is a religious activity.
Mm-hmm.
Okay, if the patient is having religious activity more, or he used to go to the mosque or temple, but he now stopped. Okay, why he
Mm-hmm.
stopped? Okay, this is a gold standard question, doctor. You have to ask about family history, always important, drug history, psychosocial, everything is important. Good thing that you gone through ICE and impact, but summary was longer. So how you going to summarize and signposting, okay? You can say, Mr. Ahmad Khan, reflect back that this sounds like a depressive episode, at least at a moderate severity based on the duration and symptom and functional impact. Are you getting me, Mr. Ahmad Khan? Okay, now you have to going to screen. How you going to manage the patient? How you going to screen the manager? We have to ask clearly about suicidal thought, plans, self-harm, and protective factors like say faith, family, and children. So you missed one thing that how about your wife? Is she supportive or not? Hmm?
Mm.
Because in the
Yes.
management plan, we are going to bring family member or friend
Mm.
in the treatment plan in psychiatry doctor. Okay,
Right.
if there is no active or intent plan or there is no strong protective factors, we are going to manage this patient with a safety netting in this our primary care setting. Okay, now you are going to explain the terms, how you're going to explain about any common and treatable medical condition involving the biological, physiological, sorry, psychological and social factors, and you have to reassure that good news is that one is not a sign of weakness, because from here you're going to take the idea of the patient. Okay, that is not a sign of weakness, that many people recover, and in that one many people recover fully. Here you know, so you should not say don't worry. Okay,
Okay.
and now you can say, Mr. Ahmed, shall we discuss management plans are there? So as per the local guidelines, as per the international guidelines, doctor, we can see first of all we have to start from psychoeducation, where we're talking about sleep hygiene, activity scheduling. Okay, how many hours he sleep, how much screen time he is having, because the person is an accountant. He's bringing the things from this work because his manager is having some problem with him, so he is doing work late night. He is having a lot of screen time.
Mm.
Okay. Yes. You rightly said that you're going to ask for CBT, talk therapy, okay, and the online programming. And for example, this patient having some sort of moderate depression, we are going to discuss that this patient has, if this patient was not having severe depression, so we can talk about only CBT, and we can say that there will be 5 session or 4 session, and after that it is not recovering, then we will be talking about other option. For example, if I forget about SSRI, okay, for example, then I can say that we will be talking about other action, other action of plan. Second thing, doctor, when you are here, if you are not talking about SSRI side effect, 2 week referral for suicidal thought, you are not maintaining that, telling the patient that it will how long it will take time to work, then whole scenario will be missed. Okay, so please focus on that one when you are going to talk in psychiatry about the medication. You should know about the side effect, okay, onset of benefit, and importance of continuing treatment. Okay, you have to tell that this kind of treatment you will be taking at least for 6 months after
Okay.
feeling better. Okay. And second thing, next visit, I'm going to see your wife. Is that okay for you? Is that okay for you if you have to bring your wife? Then we are going to suggest that we are going to involve the spouse for the support. If patient agree, you should not say that I'm going to involve your wife. You say, I'm not going to talk to my wife because my wife, she will divorce me. Okay. So here we have to take permission. Patient agree, then we say that I'm going to involve your family member. You rightly said that you are going to arrange a review in 2 weeks or earlier if there is a concern, and provide emergency contact routes. Like say, I'm giving you my contact clinic number, my number, or emergency services number. In case if you have some sort of, God forbid, if you have some sort of self-harming thought or suicidal thoughts are there, you have to call us anytime. Okay,
Okay.
safety netting, doctor, here totally different. As apart from the other topics, here we can say that if at any point you feel that you might act or any thoughts of harming yourself, or things suddenly feel unbearable, please do not wait for your next appointment. Come immediately. One. Okay. Second thing, you can say that if your mood worsen, your sleep becomes much worse and you can't sleep, you are not able to sleep, or you're sleeping for a while and you wake up and whole night you cannot sleep and you cannot uh, resume your sleep, or you start hearing something, then you have to come back to us.
Okay.
Okay, so yeah, doctor, here you have to show more empathy and calculative words, small words, and smaller sentences rather than longer sentences. Here, you don't have to worry about the thing like past medical history, surgical history. Yes, you can say ask one short. Do you have any past medical illness or any surgical procedures? That's it.
Okay.
Okay, Dr. Maida.
Yeah, thank you, doctor.
Welcome,
Ron,
Dr. Yes, Dr. Farin.
Ron, should we do PHQ9? Like, we can say that I will fill questionnaire PHQ9 at the end of the session.
You can say, doctor, as per the local guideline, as I say that in management option, because here we have different school of thought, but all school of thoughts goes to the same place. Okay, PHQ9, yes, you can go with severe or that depression, but mild to moderate, I don't consider. But still, if there is a guideline, if you are following that guidelines, our local guideline says, please follow that one.
Okay.
So, Dr. Maida.
Yes,
Dr. Maida, your patient is Mrs. Sara Ali. She is
doctor.
28 years. Yes, doctor.
Sorry for interruption. Do we need to score? What did you just say? I didn't get it. Like K10 or DIS 21, we don't have to score them.
No, no, you can say you don't have to score, but you say that I will be calculating at the end of the session. I had a management plan. So then examiner will give you the scoring.
And do we tell the patient that you're having mild, moderate, or severe depression?
Yes, doctor. Yes, doctor.
So we need to score and then we figure out if it's mild or
Yes,
moderate,
doctor.
right?
Exactly, exactly. Because doctor, here why I'm giving in a nutshell that everything, because we having or many having different school of thought. They are reading different books and different channels are there. From here, what is important here? What I'm giving you as a local guidelines or international guidelines. Here you have to follow those, please. Okay. Because for example, sometimes we are saying about as per the night guideline, but in local guideline they are following WHO guideline or they are following their own guidelines. So we have to look into all the matters. Okay. Yeah.
Dr. Imran, if we forgot to mention PHQ9, though, will they
Ah,
cut our marks? No?
no, doctor, they will not cut your marks.
Okay, okay, sure. Thank you.
Because here, what they wanted to know, doctor, that you treated the patient logically. Okay. Not like that one. If like say you forget asking about scoring in a Gatwick score or some sort of, cardiovascular risk assessment. Yes, there is a chances. Here you don't have chances. Here, because here, as per the GP level, you're going to treat either you with the CBT. They wanted to know what is CBT from the GP side. They wanted to know what is next from SSRI and mode of action, benefit, and suicidal effect or whatever so on. Here, they are not going to ask you so many things. Okay, so this is totally a different way rather than in your because they are not going to look at you as a psychiatrist level treatment management plan. Here you should know they wanted to know how safe you are and how safe the patient is.
Dr. Imran,
Oh, yes, Dr. Sharma.
can we use the word mental? Like, do you have any mental condition in the past or any mental condition in the family? Like, can we use the word mental health?
No,
Like,
doctor, you can say the same condition like you suffering. Okay.
okay.
Yes, good question. Good thing you brought up. Either you can say, is there any condition like you are suffering now in your family or anyone suffering or similar like that one? Because
Mm-hmm.
mental, psychiatric, psychology, or abnormal, this kind of words we have to, these are prohibited words to use it because we call it directly. We are going for judgmental approach.
Mm-hmm.
Yes, doctor.
Okay.
So, Dr. Maida, huh? Dr. Maida, your
Yes.
patient is 28, Mrs. Sara. Come to discuss the problem with you. Take proper history and manage the patient. Examination is not required.
Okay.
Okay, doctor.
Hi, good morning, Miss Sarah. I'm Dr. Maida here. How can I help you today?
So everyone say that I should be happy, but I just feel that like crying all the time, doctor.
Okay, Miss Sarah. I'm sorry to know about this. May I know some more details about your condition?
Doctor, I'm having 8 weeks old baby.
Hmm.
I delivered, and after 3 weeks, doctor, I just feel that low in mood.
Mm-hmm.
I feel that I'm not. I wanted to cry all the time, doctor. Irritable with the
Mm-hmm.
husband and mother-in-law, and I'm shouting at them, doctor.
Mm-hmm. Okay, Miss Sarah. Uh,
Is it all you want to tell me, or something you want to add more?
Doctor, I feel distant from the baby or at the time. I care. I do care of my baby, but worry that she is. I feel that I'm not a good mother, doctor.
Okay, Miss Sarah, I can understand your situation. Is it okay if I will ask few more questions from you? Are you comfortable?
Yes, doctor. Just do me something, doctor. Give me something that I should get better, doctor. I don't know how to become a happy doctor. I was very
Uh,
cheerful lady before, and now I don't know,
mhm.
everything gone into water, doctor.
Mm, everything will be all right. I'm here to help you, Miss Sarah. Can you please tell me that is it your first baby?
Yes, doctor, it's my first baby.
Okay. And was your pregnancy okay? I mean, there was any complication during pregnancy?
No, doctor, throughout it was normal and I delivered normally. There was no cesarean section.
Mm-hmm. Okay. And you were happy when you delivered baby initially?
No, doctor, initially doctor told me that I got baby blues in first week.
Sorry, you got what?
And I went to the doctor. She to say that I was having baby blues in my first week of
Okay.
postpartum.
Mm-hmm. Okay, then it okay. So it means that initially after having a baby, you were feeling some low mood in the beginning,
Yes, doctor. Yes, doctor.
and your doctor told you that you are facing baby blues,
Yes, doctor.
and you are still facing same symptoms.
I'm feeling doctor worse. I'm not
Worse.
feel better. Yes,
Okay,
doctor.
okay, okay, okay. Miss Sarah, may I know that like are you able to do tasks of your baby like cleaning, like showering your baby, breastfeeding your baby?
Yes, I do everything, doctor, but still I feel I'm not a good mother.
Okay, Miss Sarah. May I know why do you think that you are not a good mother?
Doctor, my husband said that I'm not taking care of my baby. My mother-in-law said I'm
Hmm.
not taking care of my baby.
Oh, okay, Miss Sarah. What do you think? That do you have enough family support from
Uh,
your husband?
yes, doctor, he's supportive, but he's having long working hours. He most of the time
Hmm.
outside. I'm alone at home.
Okay, okay. Hmm. I can understand. And is there anyone to help in like doing tasks with your for your baby with you?
No, doctor, my mother-in-law, she's having some
Hmm.
accident. She met some accident, so she's bedbound,
Hmm.
doctor.
Okay, okay. Miss Sarah, may I know about your sleep? Do you get enough sleep?
Doctor, it's like say my sleep is disturbed beyond usual, doctor. I feel that I can't sleep. First, I
Hmm.
am feeling hard to get sleep, and whenever baby cry, so I have to
Hmm.
wake up. I am not getting enough sleep.
Hmm. And are you like breastfeeding your baby or give formula milk to him?
Doctor, both.
Both. Okay. And may I know about your diet? Are you taking care of your diet?
No, doctor, my appetite is poor.
So you are not eating properly. Okay.
Yes, sir.
Miss Sarah, may I know that do you did you ever think that like life is worthless and you want to end your life, something like that?
No, doctor, but I sometimes I'm thinking that they might be better without me, doctor.
Okay. And do you think that your baby has absolutely changed your life?
No, doctor.
Hmm. Did you ever think of harming your baby?
No, doctor.
Okay, Miss Sarah, did you ever feel some sounds coming in your like you hear some sounds which other people are not hearing,
No, doctor.
or any like images appear which other people
No,
cannot see?
no, doctor.
Okay, and Miss Sarah, do you have any other illness, any other problem?
No, doctor. I was having some sort of antenatal anxiety in my first trimester, and after
Mm,
that, I didn't
mm,
took any medication.
Okay, and now it's getting bad.
Yes, doctor.
Okay. And Miss Sarah, do you think that uh, uh, like your husband mm, actually I have want to ask a private question. Is it okay for you?
Sure, doctor.
Okay. Like, are your personal relationship with your husband is okay, or you want to avoid him?
No, doctor. He's perfectly all right. He's a
Oh,
supportive person, doctor.
okay, okay. And Miss Sarah, may I know that do you smoke?
No, doctor.
Okay. And any alcohol intake?
No, doctor.
Any recreational drugs?
No, doctor.
Okay, Miss Sarah, may I know that how what do you think that what's going on with you?
Doctor, I'm worried that maybe I'm not bonding properly and maybe I'm a failure as a mother.
Okay. And is it the concerning thing for you or any other concerns in your mind?
Doctor, I'm worried about because of my mood, my baby will be affected. I'm scared, doctor. Maybe doctor might take my baby away. Maybe they will admit
Hmm.
me.
Okay, okay. Okay. And Miss Sarah, may I know that is it impacting your life badly?
Of course, doctor, I can't sleep. I can't take care of my baby. I think that I'm
Hmm.
a failure.
Mm-hmm. Hmm. What do you think? How can I help you today?
Doctor, just I am hoping some sort of emotional support, maybe talking therapy,
Sure.
doctor.
Sure. Okay, Miss Sarah, one more question. Do you get enough time for exercise and walk?
Doctor asked this 8 week postpartum. I'm not getting time for myself to brush my
Mm-hmm.
hairs.
Okay, okay. And may I know about your body height and weight?
Doctor, my BMI is 27 now.
27. Okay. Miss Sarah, do you have a family history, any other member in your family having some same kind of problem?
Well, doctor, my sister had this, they called that time, they said that she has a postnatal depression when he was the
Mm-hmm.
first child.
Mm. And how she managed?
No, they given him her some counseling and medication. That's the reason I told
Okay.
him to give me talk therapy, doctor.
Oh, okay. Okay, Miss Sarah. Okay, thank you for telling. I would like to summarize your condition that you are 28 years old. 8 weeks back, you delivered your first baby, and you have been feeling low mood, lethargy, and like lack of sleep, and not focusing on your diet. And you are feeling that like you are not a good mother. You don't have enough family support, and you are afraid that you will end up with some mental illness, and you might need admission, and your baby will be taken away from you. You
Yes,
want me to
doctor.
help you for proper diagnosis and management. Am I right?
Yes, doctor. Yes, doctor.
Okay, thank you, Miss Sarah. I would like to tell you, based upon your history and whatever information I have gathered from you, looks like that you have been suffering from a condition which is called postnatal depression. Same like you told me about your sister.
Mm-hmm.
Do you want me to explain something more, or you already aware of this condition?
Doctor, a little bit aware of that one, doctor. Just give me something, doctor. I
Okay.
can get better, doctor.
Mhm. I would tell you, Miss Sarah, that many ladies suffer from baby blues, and some ladies also suffer from postnatal depression. It usually starts in 6 weeks and ends in 6 months with proper support and some medicines which we might give you. Actually, there are due to some hormonal changes and after birth of and due to some stresses in life, some ladies feel this is called postnatal depression, in which they affect their daily life, their concentration,
Mm-hmm.
their sleep and appetite and things like that, and they are not able to feel a proper bonding with the child. Are you getting me, Miss Sarah?
Yes, doctor.
I would advise you some lifestyle modification and some medicines to get to so that will be have a good impact on your
Okay,
life.
time up,
I
Doctor
would like you.
Maida. Okay, Dr. Maida, and for everyone, doctors, just I was looking into this one because again, it is quite a challenging cases as compared to other one. So, doctor, there are four domains are there. Okay, one is a communication skill, number two, data gathering skill, and counseling skill, followed by management and investigation skill if it is there. Okay, so whenever you see this kind of patient, so you have to start from data gathering. In the data gathering, doctor, you will be getting uh, four parts are there. Okay. Number one is the presenting symptoms are there. In the presenting symptoms, doctor, we will be talking about mood, anhedonia, energy, sleep, appetite, and concentration, guilt, and suicidal thoughts for the low mood. Okay. But it is not necessary that you're going to ask each and everything. If you got one or two things positive, jump to something different, like say about worry, panic, avoidance, like say social activity, physical anxiety symptom for the anxiety or some sort of you call it body dysmorphic disorder. Yes, for schizophrenia, you can talk about some sort of depression. You can talk about hallucination, delusions are there, thought disorders are there, negative symptoms for the psychosis. And doctor, for cognitive decline, what you're going to ask about? You're going to ask about memory, orientation, daily function, and collateral information. So, for example, again, starting from the first, for the low mood, you're going to ask about mood, anhedonia for the depression, energy, sleep, appetite, concentration, guilt, and suicidal thought. For the anxiety doctor, you will be asking about worry, panic, avoidance, physical anxiety symptom. That's it. Go to the psychosis. Here, for the psychosis, you're going to ask about hallucination, delusion, thought disorders, and negative symptoms. For the cognitive decline, doctor, you're going to talk about memory, orientation, daily function, collateral information. Now, for example, patient is coming for the depression. You ask about sleep, anhedonia, energies, appetite, concentration, guilt, whatever so on. Huh? But now you're going to talk about differentials and red flags. Am I right? So one thing you will be getting from the anxiety about panic or worrisome or avoidance. One thing you will be getting from the psychosis, which will be hallucination or delusion, okay, or thought disorders. Then one, if like say if you feel that some patient having some cognitive decline, maybe young patient is there. So you can talk about memory for old elderly patient, orientation, or daily function. It's not necessary, doctor. You're going to ask about all things about from the psychosis to anxiety to decline, cognitive decline or depression. Then risk and assessment management, simple word, self-harm, suicidal thoughts. That's it. Okay. Do you feel to harm yourself or others? No, doctor. Okay. In the past or present? No, doctor. Is there any plan to think about? No, doctor. Finish. You don't have to ask about four or five liner things. No. Background, doctor, do you have any past medical illness? Same like this one. Not a cardiac or not a diabetic, not other thing, doctor. Here you're going to ask the same like this. Because patient having active problem is going on, which is psychiatric history, psychiatric plan. So we have to talk about now psychiatric history followed by, if any, then what kind of medication he used, any substance usage is there, social circumstances. You can see how with whom he is living and how his support is that one. That is also mandatory. What are the stresses are there? So many times you will be getting the cases in OSCE exam, which will be telling you, doctor, I changed my job. My manager is bad. My principal is bad, my teacher is bad. So this kind of thing you will be getting. Okay, very simple way, huh? Examination most of the time we don't go for it. Management plan is very simple. It is a structured plan. If you guys want, you can write down also. It contains only four parts are there. One thing, explain the diagnosis in the simple language. Stepped management, watchful waiting versus active management or treatment, where going to talk about psychological options and when to use the medication. Number two, doctor, indication for urgent referral or admission. If patient having suicidal thought, patient is high risk patient, psychosis is there, or severe functional impairment. Patient having lot of sick leaves are there. He don't want to go to the hospital. He wanted to kill the manager. Okay, then safety netting, doctor, of course, what to do next if like say your symptoms, your problem get a worsen and follow-up plan. Okay, then you can say that I will be if like say patient don't have any good support, family support, or moral support. Then you say that I'm going to involve our support program, like say some lady health worker or health worker programs or a specialist program, whatever shown as per the local guidelines you can talk about. Okay, so anyway, I will be giving this sheet for you. Dr. Maeda, your history, data gathering, why everything was perfect, nothing was bad. But why it was too lengthy? Because your data gathering was too lengthy. Okay. Number two, you
Yes.
had a long summary. You know, doctor,
Hmm.
everything, mashallah, alhamdulillah, very good. But again, when you have to see that you are time constrained, okay? When you're time
Hmm.
constrained, doctor, you have to shorten your words, shorten your sentences. It is not necessary that you're going to tick each and every part.
Hmm.
Okay, doctor.
Yes.
So
Yes.
yeah, so please take care of this thing, and I hope so it will be helpful for you. But anyway, I will be giving you this because I was in my even other sessions, I was looking at this one because many candidate they are feeling that psychiatry is a burden. Okay, psychiatry is a burden, so that's why they are avoiding and they are just washing their hands and coming out. But this is one of the most typical and most difficult station in the OSCE exam, doctor. Okay, here we have to be very careful in a way that we are not going to say that I'm going to treat the patient. Here, I'm going to say that I have good communication skill. I'm going to build a rapport with empathy, validating distress and non-judgmental stance. Okay, as doctor, I think one of the Dr. Simon was saying that mental problem. So we have to go in a non-judgmental stance. Okay. And we are going to gather relevant data rather than irrelevant data, especially for the risk and function and impact. Is there any impact on the family or work? Okay, and we are going to consult the patient because here 5 minutes for the data gathering and 5 minutes for the management plan, doctor. So, Dr. Farheen,
Yes, doctor.
Dr. Farheen, your patient is Mrs. Neha Verma. She is a 30 years old female. Um, She come to discuss some her problem with you. Take proper history and manage the patient. Examination is not required.
Okay. Good
Okay,
morning,
Doctor.
Mrs. Neha. Good morning,
Yeah,
Mrs.
good
Neha.
morning.
I'm Dr. Fahim. How can I help you today?
Doctor, I just can't stop worrying about everything all the time, doctor.
Mrs. Neha, can you tell me more about it?
Doctor, it's been 6 months now. I'm worried about my work, about my health of my parents. I'm worried about my financial issues out there. I keep on making small mistakes, doctor. I feel restless, doctor. I just wanted to fight with anyone, doctor. I feel all the time on the edge, doctor. I have muscle tension, doctor, in my shoulder, my headache. Doctor, whole myself, whole myself is really problem.
Okay, so sorry to hear about that, Mrs. Neha. I just want to ask you more questions. Is that okay?
Sure, doctor.
Okay, so Mrs. Neha, tell me exactly since how many months you are facing this problem?
Doctor, it's been 6 months now.
Mm-hmm. And within the past 2 weeks, do you feel more nervous, more feeling on the edge?
Of course, doctor.
Mm-hmm. And excessively worrying thoughts that are unable to control?
Yes, doctor.
Okay. Okay. So, Mrs. Neha, tell me, did you take any medicine for it or go for the any checkup?
No, doctor.
Okay. Okay. So, Mrs. Neha, tell me about your mood nowadays.
Doctor, I am feeling all the time on the edge. I wanted to fight.
Mm-hmm. And is there any particular reason behind it, like you want to fight with everyone?
No, doctor, nothing.
Mm-hmm. And okay. So, Mrs. Neha, tell me about your appetite.
My appetite is, doctor, a bit less actually.
Okay. And is there any complaint of chest discomfort?
No, doctor.
Mm-hmm. Any complaint of choking?
No, doctor.
Okay. And any complaint of heart racing?
No, doctor.
Okay. Okay. So, Mrs. Neha, tell me, do you have any fear of dying?
No, doctor.
Okay. So, Mrs. Neha, uh, tell me about, are you married?
Yes, doctor.
Mm-hmm. And how's your relationship with your husband?
Doctor, he's supportive, doctor.
Mm-hmm. Okay. And how many kids do you have?
Doctor, I have one child.
Okay. So, what's your last birth?
Doctor, he's 7 years now.
7 years. Okay. Okay. So, Mrs. Neha, tell me, is there any long-standing illness?
No, doctor.
Okay. And is any member of your family affected with the similar illness?
No, doctor.
Okay. And are you taking any drugs on regular basis?
No, doctor.
Okay. Okay. So, Mrs. Neha, tell me about what do you do?
Doctor, I'm working in the IT sector. I'm a software management
Mm-hmm.
planner.
So, yeah. Okay. So, Mrs. Neha, tell me about your work. Is it the stressful type of the work or
Yes, of course, doctor. My job is like that because I'm dealing with whole company software, so it's very stressful, doctor.
mm-hmm. And recently, have you changed your job?
No, doctor.
Mm-hmm. Okay. So, Mrs. Neha, do you smoke?
No, doctor.
And do you take alcohol?
No, doctor.
Any other recreation drugs?
No, doctor.
Okay. I just want to ask a private question. Is there any difficulty in maintaining a private relationship with your husband?
No, doctor.
Okay. So, Mrs. Neha, is there any financial problems going on?
Well, doctor, let me tell you, my
Mm-hmm.
parents both are elderly, 70 or
Yeah.
72. I'm taking care of
Okay.
them. I'm supporting them. They're living alone, doctor. I'm worried about all the time. I'm living anyhow just next to the neighborhood, but still I'm worried about if anything goes wrong, who will be taking care of them?
Mm-hmm. Right. I can understand, Mrs. Neha, that how you are going through. And how's your parents now?
Doctor, they are doing good.
Mm-hmm. Okay. So, Mrs. Neha, tell me, is there any neck gland problem?
No, doctor.
Mm-hmm. And have you recently quit alcohol?
No, doctor. I'm not taking alcohol at all.
Okay. Okay. So, Mrs. Neha, do you feel more cold or more hot as compared to other person?
No, doctor.
Okay. And is there any type of the kidney disease?
No, doctor.
Okay. So, Mrs. Neha, what's crossing your mind? What do you think?
Doctor, maybe I'm overthinking, or maybe I'm having nerve weakness, doctor.
Okay. And is there anything that worries you most?
Just worried maybe this kind of anxiety will cause some serious physical illness or maybe stroke, doctor.
I hope not. And Mrs. Neha, what do you expect from me?
Doctor, just want some strategies to control the worry, and I'm open to any therapy, doctor. Just take away this all the worries from me, doctor.
Sure, sure. We will definitely discuss each and everything in detail. Don't worry about that. And Mrs. Neha, how far this thing impact your life?
Doctor, of course, it is affecting quality of life and my work life. Everything is affected, doctor.
Mm-hmm. Okay. So, Mrs. Neha, one to two things I just want to ask more. Do you know what's your last BMI?
Doctor, my BMI is 25.
Mm-hmm. And what's your last menstrual period?
Doctor, 3 weeks ago.
Okay. Okay. So, Mrs. Neha, I just, after taking history, and I'm just suspecting that probably you have a condition. Sorry, I just want to quickly summarize it. Okay. So, you told
Mm-hmm.
me that within the past 6 months, you are facing these type of problems, that you are excessively worrying thoughts and unable to control the, worrying thoughts and feeling nervous and, it, and you think that it must be something like nerve weakness and some other thing, so you want some medicine and some other type of the treatment. Anything else you want to add?
No, doctor, that's it, doctor.
Okay, so Mrs. Neha, after taking history, most probably you have a condition which is called generalized anxiety disorder. Do you have any idea about this?
No, doctor, what's this, doctor?
Okay. Basically, sometimes, every person has some type of anxiety in our life. But if this anxiety, if this thing aggravates so much that it affects the quality of your life, then it is called the generalized anxiety disorder. Are you getting my point?
Okay, doctor.
Okay, so first thing what you have to do, there are two type of management. Like one is the lifestyle modification, and the other one is the medical management. Okay,
Mm-hmm.
what would you like to discuss? What you want to discuss me the first?
Doctor, what is feasible to me and less harmful?
Okay, so first we will start with the lifestyle modification. Okay, as you told me that you are worrying a lot of things and it affect your quality of the life and your work. So how about just take some rest and improve your sleep. Go to the same time of the bed every day. How about that?
Sounds good, but doctor, but I can't do because I have to bring work from office to home.
Okay, so so how about take do some work in the evening time or morning time? How about that?
Doctor, sounds good, but doctor, can you write me a letter for my office that I cannot
Sure,
bring
sure.
my eye show?
I will definitely write a letter and I will tell each and everything in detail to the manager that it's definitely essential for your health, right?
Sure, doctor.
Okay, and avoid any distractor at the night time, your mobile phone, your TV, and also take some time out, go for out and do some exercise, do yoga. It will better, you will feel better, you will improve your symptoms. Okay?
Okay, doctor.
You can make new friends, you can discuss each and everything with your friends, okay? And I'm also refer you to the special type of talking therapy which is called cognitive behavioral therapy, and with the help of the talking they will improve your symptoms, okay?
Okay, doctor.
Okay, so if your symptoms are, meanwhile, I'm also adding you a drug which is called tablet sertraline, 50 milligram OD. You have to take it once a day, but it will take at least 2 to 3 weeks to show the response. Okay.
Okay, okay, doctor.
Okay, but initially the anxiety level is increased with this drug, so don't worry about that. Okay, if in case you are facing severe type of the anxiety level, then you have to come back to me immediately. Okay.
Okay, doctor.
One thing I just want to ask, is there any history of the self-harm? Have you ever tried to end your life?
No, doctor.
Okay. So if in case you are facing this type of symptoms, self-harm, then I'm giving you a number you can share with your friends and family. Okay. Mental health crisis team. If in case you are facing this problem, then you have to contact this team immediately. Is that okay?
Okay, okay, doctor.
Otherwise, follow up in the 2 weeks. I am giving you a leaflet, everything, each and every lifestyle modification in given in the detail. You can just go
Mm-hmm.
through it, and if your symptoms are not controlled, then you can go talk me immediately, anytime, whatever. Don't wait for the follow up. Is that okay?
Okay, time up, Dr. Fareen. Well done. Except one sentence, I will be saying that everything was perfect. That was, crisis management team. There is no team in Pakistan and India, Bangladesh and Sri Lanka. So try to avoid this kind of things. Okay, this kind of things examiner don't like.
So, what type of team we have to offer?
No,
Like,
you have to say emergency. Call, go to emergency. Okay, come to clinic, this clinic or nearby clinic. That's it, doctor. There is no
okay, so
crisis
we have,
management team in Pakistan.
okay. So we should share the number with the family members, na? Because patient don't have any, idea about kids, whatever the condition is.
No, doctor, you can say that I'm giving you my clinic number or my number. This is my number. If you feel free to talk me and tell your family members if any problems, just call me.
Okay.
Okay. And doctor, history was prolonged a little bit, but still I feel that you did well done. So I am not pointing out many things because you gone through concise and particular way. So it was quite hopeful for me that did a good job because there is nothing such thing just except now tell me, because if you say that now tell me, it means like say you're ordering the patient, you have to say may I know. Okay, may I know about your condition? May I know about Mrs. Sara about your health? May I know Mrs. Sara about your smoking? Or may I ask about that one? Okay, this one we call
Okay.
patient-centered approach. Now tell me, doctor, you have to avoid. Don't use this kind of sentences. Okay, here it will come as a doctor-centered approach rather than a patient-centered approach. Okay, this is we call it interviewing. Here we are not gathering the data. It will be a interviewing. Interviewing is totally different, and data gathering is totally different.
Okay, doctor.
Yes, doctor. So this simple things are there, doctor. Everyone is ready, alhamdulillah. Okay. Only that simple tweaking needed and confidence needed. I can assure you, doctor, there is no such thing that can stop you guys from, going clearing the exam. Only important thing, self trust. You trust yourself. If you are trusting yourself, believe me, there is a simple thing that you can make it a impossible thing also as a possible. This is nothing is impossible in this exam. Exam is that one. I know that many times we do the mistake. I myself did a mistake in my exam. Okay, I'm clearly saying that I did a mistake. The reason because when we do the mistake, we learn from the mistake, doctor. Okay, then we have to know that how to recorrect or correct the mistake at the same point. Okay, simple example I'm giving you. I was taking the patient history of hyperthyroidism. Patient was giving thoroughly history of hypothyroidism. Okay, I myself made my mind. But when I say that I'm going to examine you, patient started, doing some sort of hand tremors. And she given me the picture of, goiter, big gland. Then I saw, initially I said that I'm suspecting that you're having your thyroid gland is showing some sort of hypofunction or nothing. Okay. Then I corrected myself after the examination. I said, Mrs. Tania, that I'm suspecting that you are suffering from the condition, thyroid condition. For that one, I need to do few investigation. I corrected myself at that point. Okay, she said, what? I said, I'm going to do your thyroid profile, followed by the thyroid profile, CBC, and other parameters. Then I'll be doing your ultrasound. She said, okay. Okay, the thing here, if I'm doing mistake and I'm not correcting my mistake, that will be a problem. But if I'm correcting the mistake, that will be perfectly all right. Okay. So Dr. Hafsa Iqbal. Dr. Hafsa, are you ready?
Yes, doctor. Yes.
Dr. Hafsa, your patient is Mr. Bilal Sheikh. He's a 27 years old gentleman. He's having some problem. Take proper history, management, and counsel and take history and management. No examination.
Mr. Bilal, how old?
He's a 27, 27.
27. Okay.
Yes, doctor. Start.
Hello, Mr. Bilal.
Hi, doctor.
I am Dr. Hafsa with you. What can I do for you today?
Doctor, look like I'm going to die, doctor.
Mr. Bilal, can you please tell me more? What do you mean by this?
Doctor, I don't know what to say, doctor. My heart racing, my chest tightness. I'm feeling that someone is holding my breath. I'm feeling trembling, doctor. I don't know, doctor. It's like just some sort of thing that I'm feeling impending in the doom.
It can be really very difficult for you. So, is that okay if I ask you a few more questions?
Sure, doctor.
Mr. Bilal, can you tell me since how long you are feeling this way?
This kind of thing, doctor, keep on coming since 3 months now.
So, is it all the time or it comes in episodes?
It comes in episodes, like doctor. Sometimes it takes sometimes 20 minutes, sometimes 10 minutes. Automatically it goes back, doctor. I visited many times to the hospital. They did everything. They say everything is normal. No problem in my heart, no problem in my chest, doctor.
Happy to hear this. So this comes in episodes, yeah.
Yes,
And
doctor.
so, Mr. Bilal, tell me, is there any specific reasons behind that you find that these things can be triggered because of that?
No, doctor, just I don't know what to do, but I think that I am having some heart problem that doctors cannot detect, doctor.
But you said that they have seen you and examined you, but they did not find anything, yeah?
Yeah, doctor, but sometimes test also can lie, doctor.
Okay, okay. So tell me, at any point, have you felt hot when others do not?
No, doctor.
Okay. And how is your mood on most of the days?
I used to, I'm a really happy person, but the thing, this kind of thing now making me worrisome.
Yeah, I do understand. I do understand. So, do you avoid gatherings and these days?
Yes, doctor, these days I have, because I'm fear that I will be getting attacked in the public and I will be feeling embarrassed. So I avoid crowds and places and buses even.
And how is this affecting your sleep?
Doctor, my sleep is okay, but nowadays, again, I feel that my sleep is a bit disturbed, but not that much, doctor.
Okay. And how about your appetite?
That's fine, doctor.
Okay. Do you feel like worthless? Do you have any
No,
of these?
doctor.
Any
No,
guilty?
doctor. No, doctor.
You hear some abnormal sounds which others do not?
No, doctor.
Any times you thought of harming yourself or anyone around
No,
you?
no, doctor.
That's good. Okay, Mr. Bilal, tell me, do you have any chronic medical conditions?
Chronic medication condition. What, doctor? What is chronic, doctor?
Sorry, any medical problems you have?
No, doctor. I had asthma, doctor, when I was child.
Mm-hmm.
But nowadays I don't have any problem.
Okay, so that is control, yeah?
Yes, doctor.
Okay. Any medications you are taking due to any reasons?
No, doctor.
Okay. And family history of similar problem or any psychiatric issues?
No, doctor. Psychiatric you're talking about, but I don't know. My mother had some sort of anxiety problem. She used to take the medication, doctor.
Mm-hmm. And how she's doing?
She's doing good, doctor.
Okay, okay. So, Mr. Bilal, tell me, do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
Are you using any recreational drugs?
No, doctor. I'm taking mostly the coffee, strong coffee, black coffees. I'm taking 5 to 6 times daily.
Mm-hmm. I see. So, tell me about your diet in general, apart from these coffees. How is your diet in general?
Doctor, I'm foodie person. I'm eating everything from outside, at home.
Mm-hmm. And what do you do exercises?
I used to go to the gym, but nowadays I'm not going because I'm feared of getting panic attack again like this.
Mm-hmm. And how about your body weight according to your height?
My BMI is Doctor 24.
Okay, that's good. That's good. So tell me, with whom do you live?
I'm living with my parents.
Mm-hmm. And is everything okay?
Yes, doctor.
And what do you do for a living?
Doctor, I'm working as an accountant.
Accountant. Is there any stress in your job?
No, doctor.
Mm-hmm. And how do you cope with these this is fears and everything in your job and your daily routine?
Doctor, first of all, I don't have any fear, but in case if it just comes, so I try myself to do it better.
Oh, okay, okay. So what do you think is going on with you?
I think something very serious problem with my heart or maybe brain that doctors are missing, doctor.
Okay, okay. So what makes you worry the most?
Maybe I died during the attack, and that's why I don't go outside home.
Mm-hmm. And in which way I can help you?
Can you do some different scan than other doctor did?
Okay, okay. So let me summarize. Mr. Bilal, you said that for the last few weeks you are feeling like anxiety and you are feeling that it is like impending the dome. And because of that, you are trying to avoid yourself in these situations. You are thinking that it might be something serious and in your chest, and you want me to do some investigations for you. Is that all?
Yes, yes, doctor.
Okay, so Mr. Bilal, what it looks to me, it is like you have something we called panic attacks. Did you hear about this thing before? Before?
No, doctor. This is what is this panic attack, doctor?
So this is the intense fears of something bad will happen. Okay, it comes in
Mm-hmm.
episodes as in your case, and this is most commonly without any known reason. But the good thing
Mm-hmm.
that it goes away by itself, as you said.
Mm-hmm.
So let me reassure you that, as you said, that you have gone to multiple doctors, they have done all the investigations for you, and they did not find anything abnormal. So
Mm-hmm.
this, yeah, so this is the reassuring point. So in your case, Mr. Bilal, it is that we can give you some therapies that called CBT, cognitive behavioral therapy. So is that okay? You want me to tell you how it can be given to you?
Okay, doctor.
So these are the talking therapies in which we can help you to change your thoughts and your behaviors. These are about 5 to 6 sessions, and after 2 to 3 months, it will be very good if I can see you again. How do you do with that?
Okay, doctor is successful all the time.
Mr. Bilal, most of the time these CBTs really it can help, but in case if it doesn't help, or if we find that your symptoms are not improving, or if you think that you might harm yourself, then you can come again for sure. And then there are some medications that we can prescribe for you, like antidepressants. Okay.
Antidepressant, doctor, you think I'm mad, doctor?
No, no, no. I'm not saying that you are mad, but this is the conditions in which the treatment is these medications in the stages in which, if you are not improving on treatment, self-help treatment, this will be the
Okay,
second
okay,
option. Okay.
okay, doctor.
So,
Okay.
so for now, we can help you out in engaging you in some online help. There are some there are some support groups. I can give you a leaflet also about this condition, so that you can go through it, and you can have more knowledge about this one. If you have any questions in future, please make sure to come again to us. 1 minute, just 1 minute. Okay, Mr. Bilal?
Okay, doctor.
Anything that is not clear you want me to clarify for you?
That's it, doctor.
Okay, and don't worry, please make sure to take these sessions properly, and I hope that you will be doing well with this. So if you have any questions in future, please make sure to do not hesitate to ask me, or call the you can call me at any time.
Okay, doctor.
Okay, and something more important also, please take care of your sleep hygiene. Please make sure to go to the bed earlier as possible. And regarding your coffee intake, please try to reduce the intake of these coffees, because these things can make you having more these symptoms, like heart racing, shortness of breath. Okay.
Okay, doctor.
Okay, thank you very much for your coming.
Okay, doctor.
Doctor, actually, I have a patient also.
So yeah, patient, doctor. Okay, but I'll be telling everyone. Dr. Hafsa, you did good job, but a few things I wanted to mention. I wanted to ask you, but since you have the patient, so anyone can tell me that why we will call this panic attack?
Doctor, isn't because of episodes?
Doctor, episodes, and
Yeah,
another thing we have to,
And
one
it
is
goes
episodes,
away.
and another thing we have to ask him here, that are you fear of getting it again and again?
yes, exactly. Okay, and there are 3 points are there, doctor, for everyone. Okay, we call it how we are suggesting that this is a panic disorder, not attack, is a panic disorder. Okay, recurrent unexpected panic attacks. Okay, then number two is at least one attack followed by 1 month or more of. Okay, means like say persistent concerns of or worry about additional attacks to their consequences, as patient was mentioning, and significant maladaptive change in behavior or related to the attacks. Patient was avoiding to go outside, and symptoms not better explained by the substances or medical condition or any other mental disorder. For example, he was saying that they did everything, doctor, but everything was fine. I think they're missing something. Right. So here we have to see here. Then what else we will be thinking about this one? Somatic order. What you call it? There is one more condition is there, no? It might mimic such conditions. Anyone
Somatoform
have?
disorder. Somatoform
Yeah,
disorder.
maybe sometime we might think about this thing. Okay. But here only we have to see the three things are there. It will be easily. Now, what are the general principles are there? So general principles are there where what we call it, validate the patient's experience, explain the diagnosis and provide the clear information. That was the agenda of this case. And we are going to address the fear about serious physical illness. Okay, once appropriately investigated. For example, here investigation was not required. So we were talking about a patient, how counseling and based on patient data gathering. And we're going to explore and address the comorbidities. For example, a patient having depression or substance misuse, like say he's taking. Yes, here we have to talk about patient coffee and tea also, because palpitation he was getting a lot. He was taking strong coffee. Okay, we call it a psychoeducation. There are few points are there. We have to say that what panic attacks are there and why symptoms occur. We call it fight or flight response. I think fight or flight response. Okay, then we will be talking about role of catastrophic misinterpretation of bodily sensation, like say patient was getting palpitation, patient was getting chest tightness, this kind of thing. Okay, and we have to explain that this is a benign nature of physical symptoms. Okay, if we already excluded this patient, as this patient was gone to ED and they did some ECG and other investigation, they rule out something that he is perfectly all right. Okay, so we can say that this is a physical symptoms are there. This is a it is a benign in nature. Okay, and the vicious cycle of anxiety, like say avoidance and maintenance of the symptoms. So we are going to say that I will be giving you written information, or I'm giving you this online resources, website address or pro forma. You can go and you can read, and whenever possible, if any question query, you can come back to me. First line always is a CBT. Okay, what is CBT? We have to explain the patient, then pharmacological management. Then what is the first line management, doctor, here? Dr. Sanobar?
Paroxetine.
Pharmacological.
Sir, is it the benzodiazepine?
Paroxetine.
Okay. Anyone else, doctor?
First line is
Beta blockers? Beta blockers?
No,
you don't
Fluoxetine.
no first line is
Fluor,
CBT na.
Fluoxet.
We have to
Give
First
your
use
line.
CBT
Dr. Anna,
self-help,
are you
and
discussing
second line is
about
SSRI.
medication or lifestyle?
first
No,
line
no,
is
no. I'm
CBT.
talking about pharmacological SSRI, doctor.
SSRI.
Sertraline is the
Yes,
best
okay.
option.
SSRI. Certainly,
Yes,
certainly.
certainly is the best option, okay. Then citalopram, then acetalopram,
Then
and
we can give for
paroxetine.
the sleep as well, alprazolam also, for PRN only.
Yes, doctor. Okay. Now, how we are going to when we are going to say and what we are going to do it, that we call it key prescribing points are there. Okay. Always you have to cross check with the local guidelines. I'm telling you, doctor, we have to cross check from everywhere. Okay. But as per my knowledge, as per my data, whatever I gathered, as per that one, I'm going to tell you that we have to start at the lowest dose and titrate slowly. We have to mention to the patient, okay, we are going to warn the patient about potential transient increase in the anxiety in first to 2 weeks. You can say that after taking the medication, your symptom might worsen. Okay. And we have to advise it may take several weeks, like say 2 to 4 weeks for full therapeutic effect. Okay. And Mr. Khan or Mrs. Sara, you have to take this medication for 6 to 12 months. Okay. Without any break. Okay, once response achieved, then we will consider gradual taper. We should not stop it suddenly or abruptly. Okay, now for example, doctor, OSCE scenario arise. Patient is taking all the medication, done through CBT. CBT is failed. Patient is taking this medication. What is second line? Okay, second line, doctor, always we are going to refer this patient to the specialist advice. What he will do, doctor, what he will do with me? We will see that he might try some other drug like say SSRI or SNRIs. Like say Venlafaxine or whatever, so TCA he might introduce, or maybe benzodiazepine. Okay, but again, benzodiazepine, if you're talking about, it is not recommended for long-term management due to dependence and tolerance, doctor. So such case, like say, why I'm talking about little bit more higher side, because now day by day OSCE exam is getting more and more specialized and more particular. So any kind of scenario might arise. So why I'm taking you to all three steps, because here we are going to cover all three scenarios. One is a simple CBT. Second scenario arise, Dr. CBT failed. What is next? This is the first line, SSRI. Third scenario, doctor, this is also failed. What is next? I'm going to refer you. What he will do? He will be doing this thing. So you know that what he is, doctor, he is going to do it. Okay. What are the indications of referral? Okay, we have to we have to consider for the referral to the secondary care or patient to the brain specialist, okay, or not mental specialist, mental health services. If you take mental health services as per the South Asia guideline, they don't consider this because they say मैं पागल हो गया kind of stuff, okay. So please avoid this one. You said I'm sending you the brain specialist or thought specialist, okay. When you're suspecting diagnose uncertainty, for example, if I'm the one a doctor, I'm performing in my exam, I found that diagnosis uncertain, or maybe Patient having significant concerns about some serious illness, or maybe patient having psychiatric illness is there. Patient having severe functional impairment or high suicidal risk. Patient is having absence from the work because he don't want to go to the work because of some sort of a harmful environment, or maybe patient having suicidal thought. I have to refer this patient. Number 3, doctor, failure to respond to adequate trials. Okay, of the first line psychological and pharmacological treatment. So third is referral. Number 4, doctor, significant comorbidities are there. For example, this patient having bipolar disorder, either patient having psychosis, or patient is using some sort of substance, or patient having some sort of severe depression. Okay, or maybe patient having complex social circumstances where we have to involve multidisciplinary team. Okay, but why I'm talking about this one, because nowadays again scenarios are getting a little bit more and more complex. So it's not one scenario to talk about. Okay, Doctor Hafsa did one scenario. We are going to talk. No, the thing we have to go with some other possibilities. We might get this scenario. We might get that scenario. We might get other scenario. So it is possible. Only important thing how we are going to cope with that one. Okay, Dr. Sunobar, you are ready for the case?
Dr. Imran,
Yes, Dr. Farin.
it's mentioned in GP that we cannot prescribe benzodiazepines in panic disorder.
Yes, doctor. You cannot prescribe benzodiazepine. We can say that SSRI, but first line is always CBT followed by SSRI. Second line is always there, but we are going to set this. Going to send you to refer a specialist. Okay, he will do or she
Oh,
will do.
okay.
Dr. Sanobar, you ready? Okay, Dr. Achene,
Yes, doctor. Okay. Sorry,
ready?
I'm in OP. That's why. Yes. Okay.
Okay, so I'm giving you a case. Doctor, your patient is Mrs. Rahman. She is a 32 years old female.
This
Okay. She's a 32 years old female,
Mrs.
Mrs.
Doctor?
Rahman. Rahman.
Mrs.
Oh, Mrs. Khan. Mrs.
Okay.
Khan is easy for you. Okay, Mrs. Khan. 32
Okay.
years old female, come to discuss her problem with you. Take proper history. Examination is not required and manage the patient. Okay,
Okay.
start.
Hello, Mrs. Khan. I'm Dr. Snowbird. How can I help you?
Hi, doctor. I think I sound silly that what I'm going to talk. Doctor, please bear me. But I just can't stop washing my hands, doctor.
I can understand. You look worried. Can you tell me more, Mrs. Khan?
Doctor, for the last 1 year, doctor, I'm having this problem. I'm using some sort of, I have some sort of intrusive thoughts that my hands are contaminated. I might get some sort of infection and I might give this infection to my child, doctor. I feel that I have to wash my hand every 2 hours, and I feel that I can't bear, doctor.
I will try my best to help you, Mrs. Khan. Can I ask some more questions to you?
Sure, doctor.
You said that you keep on washing your hands since last 1 year. So, is it because you said that you feel there are germs?
Yeah, doctor, I feel that my hands are contaminated, doctor.
I can understand. And did you try it at some particular time or all the time?
All the time, doctor. Mostly up to 2 hours, I can't tolerate. I have to go to washroom and I have to wash my hand, doctor.
Okay. Have you ever tried to resist this? Like you are not washing hands and you try to do this. Did you ever try to do that?
Doctor, I tried, but I have to force myself because I don't want to see my child, infected again.
I can understand your concern. We'll try my best to help you, Mrs. Khan. Mrs. Khan, can you tell me that do you try to put the things in order? Always, you want the things in an order?
No, doctor.
Okay. Anytime, do you think that you take longer to finish your activities?
No, doctor.
Okay. Anytime did you feel that you want to check your dose regularly?
No, doctor.
Okay. Can you tell me that do you have do you smell something what others cannot?
No, doctor.
Do you hear something what others cannot?
No, doctor.
Okay. How was your mood last 2 weeks, Mrs. Khan?
What is fine, doctor? I'm happy. But now you see that my hands are getting cracky, doctor.
Mhm.
My hands are dry, even though I'm using a lot of
Can I
creams.
see your hands?
Yes, doctor, you can see this. You see that my hands are cracky and there's the blood
Can I
is
see
there
your
in the hand.
I can understand. We'll talk about it, Mrs. Khan. Can you tell me that do you feel you are not interested in doing the activities what you were doing earlier?
Well, doctor, I don't want to go outside and I don't want to leave my house. Even though I feel
Mm-hmm.
late for my work, but I don't want to leave my house because I feel that outside germs are there. It will come to my hand and my child will get again infected, doctor.
I can understand your concern. Did you ever feel that you are high and low moods in between?
No, doctor.
Okay, did you ever got this that your child also get infected or you feel that because of your germs they got some infection as you are so worried about that? Did it ever happen?
Yeah, doctor, last year I went to one trip to Georgia and my child was admitted because of, contaminated hands and water. Doctor told me because of my hands, because I was involved in some activity. And after that, this came into my mind
Oh, I
that
see. Mhm.
I this happened because of me. So I keep myself that this happened to me. So I should keep washing my hands. I don't want to see my child again in the hospital, doctor.
I can understand your concern. Okay, can you tell me that do you feel low and high moods in between?
No, doctor.
Do you have any mental problems in your family, like depression?
Doc no, doctor.
Okay. Can you tell me, do you take any long-term medication for any illness?
No, doctor. I'm using this AMOLED cream because of and topical steroid because of this my hand condition, doctor.
Mhm. Okay. Do you have any long-term illness like high blood pressure,
No, doctor.
high sugar,
No, doctor.
high fat in the body?
No, doctor.
Okay. Can you tell me that what do you do for living?
Doctor, I'm a teacher.
Teacher. And how's the things at school?
Doctor, home and work fine until unless I'm washing my hand. That's fine, doctor.
Okay. And whom do you live with?
Doctor, I'm living with my husband and my child.
Okay. When was your last periods? Can you tell me?
Doctor, my last period was 2 weeks ago.
2 weeks ago. And by any chance, are you taking any birth control pills?
No, doctor.
Okay. Are you by any chance are you pregnant?
No, doctor.
Okay. Do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
Any drugs you take for enjoyment?
No, doctor.
What's your daily typical diet? You eat everything or you have some specific diet preferences?
No, doctor, I'm eating everything.
Okay. What do you think about this? As you said that you are worried it might be some germs. Any other idea you have about your condition?
Doctor, I think I'm going mad, doctor.
Don't worry, I will try my best to help you. Can you tell me that, accept this, that you will get the germs to your kids? Do you have any other worries?
No, doctor.
Okay. In what way you want me to help you?
Can you tell me, is there any therapy or any treatment is available for to control my habits?
Sure, sure, we'll talk about it. And is the as you said that this is making you giving you more anxiety and more pressure on your brain. Is there any other impact on your life?
No, doctor.
Okay, okay. Mrs. Khan, let me summarize. You came today because you have this, you are washing your hands frequently. It's since 1 year because you feel that there is germs in your hands. Okay, you are worried that this might be something serious and you want me to give you some therapy that will help you. Is there anything you want me to add?
No, doctor. That's it, doctor.
Okay, okay, Mrs. Khan, after taking your history, most likely it looks like that you have a condition called obsessive compulsive disorder. You have any idea about it?
What is this, doctor?
Actually, it's an unreasonable thoughts of fear, okay, of getting something, and in view of getting that, you are repeatedly doing that things. Are you getting me? So
Okay, doctor.
you have fear of getting the germs, and because of that, you are keep on washing your hands. Are you getting me?
Okay, doctor.
Okay, so I would like to first assure you there are some lifestyle modifications. It's not something that there is some germs in your hand. It's just because of some thoughts of fear in your mind that is making you thinking like that. So we have some treatment for this and some medication also. So can we discuss that?
Sure, doctor.
Okay, I would like to refer you for some self-help groups in which the people having the same conditions, they will talk about it and they will discuss the what they are going through and how they are tackling this. Are you getting me?
Okay, doctor.
We have a therapy called the we have a therapy called cognitive behavioral therapy in which a therapist will sit and they will talk about the positive thoughts, taking the negative thoughts about it. Let's do one thing, Mrs. Khan. Let's break the cycle, okay? And let's do something that we will make one that is called exposure and response procedure in which we will get used to some infected things, okay? And then we'll make you sit at one place and we'll see how you can resist that. Is that okay? Is it possible for you to do that?
Okay, doctor.
Okay, so let's try this, and after if it is not affecting you, then we have some medications also, but better we will go for this first. I would like to give some advice on your sleep also. Okay, try to sleep on time. Okay, make sure that whenever you sleep, take your gadgets out of your place. Okay, do some deep breathing exercises like yoga, meditation. Okay, that will also help in taking your stress. So you don't need to worry. It's not because that your the hands are dirty and you will give it to others. It's not like that. And about your hands, as you said that it has scratches and it feel like that. What about giving you some cream? I can give you some cream
Okay,
like
time up.
that will help in you. Okay.
Dr. Snabar, good attempt. Just asking one question from everyone. First, you asked to tell me what is obsession and what is compulsion?
Obsession means she has something in mind and she want to do that again. Compulsion means she's getting compulsed to do that again and again.
Well done.
Right?
And what are the key differentials are there?
He is obsession means like she's going and she's washing hands. Sometimes they will keep on checking the doors. Sometimes they will feel that just of fear of they have some fear inside, some anxiety we can say. So of doing that, and in that anxiety they are keep on repeating that things. That is the compulsion. That anxiety is compulsing them to do that things.
Doctor, so she cannot resist it. She'll
Yes, doctor.
Yeah, that's what I
And
asked her. No, you cannot.
because doctor, why I selected this topic today of OCD, because OCD very vast topic. It's not a simple
Bite.
topic that
Yeah.
yeah, because here what we are talking about, this is a group of disorders. Okay, repetitive thoughts and behaviors, which
Mm.
includes OCD. Okay, body dysmorphic disorder, body focused repetitive behavior disorder. Like say, patient is pulling the hairs and eating here and biting nails. Okay, dermatomania, dermatillomania, okay, hypochondriasis, okay, and hoarding disorder. These are the four scenarios or five scenarios are there,
Oh,
doctor. Five different scenarios might arise in the exam. Okay, this is one of the most interesting topic to understand. So myself gone through this one too because I was looking at from 2011 till 2025, 2026 exam. This kind of scenario arises many times, doctor. But many time, one thing repeatedly being mentioned by the candidates, which was quite irritating for me. The reason because we call it, following the straight line. No, it is not a straight line, doctor. We have to think something different, a little bit away from the straight line. Also, we have to see what is lying on beside the line. Okay, so we have to think it is a group of disorder. First is OCD, second is a body dysmorphic disorder, and the third is body focus repetitive behavior disorder and hypochondriasis and hoarding disorder. Many candidate doctors fail when they are about to explain about obsession and compulsions. Okay, many candidates fail, then they are thinking everything is a body morphic disorder and OCD. Because this only two things where I gone through that past exams, many candidates they say BDD came or OCD came, doctor. Okay, agree. But no, doctor, there was something different was there. Because I gone through few emails and few other candidates, they shared with me their data. Why they get failed? Because they were unable to diagnose properly. They did everything. Okay, now let me tell you, typically mostly that repetitive thoughts are there, doctor. These are intrusive and distressing. In the case of OCD, you talk about body morphic disorder or hypochondriasis. Okay, and repetitive behaviors and compulsive and habitual means like say of reducing distress, which becomes difficult to the person to control. Mostly it happens in OCD and patient pulling the hair. We call it trichotillomania. Okay, and dermatillomania. Okay, these are the there, and also hoarding disorder. Have anyone having hoarding disorder? I mean, what does it mean, doctor?
So what is dermatillomania?
Ah, good thing, doctor. Dermatillomania likes pinching the skin or playing with hands or like this, just like a playful kind of thing. No, when I'm stressed, I'll be keep on biting my chest. I will be keep on biting my thighs or something like this. But I need to confirm it further, and I will tell you. Okay. Uh, hoarding disorder, doctor. Anyone having idea?
Which disorder?
I think, doctor,
Hoarding
that
it.
is also mental disorder. They are also having that persistent difficulty, in discarding some thoughts or something they have in their mind.
Okay. Okay, here this patient, mostly the patient having insights are poor. Okay, patient commonly see that problem in their own terms, not understanding rather than themselves. Okay, they will be thinking about excess clutter in the home or rooms, difficulty using spaces as intended. Patient will be saying that strong attachment of to possessions, even objectively low value items like the newspaper, packaging, broken objects are there. They will be keep on collecting, no? Okay, avoiding to make decision about discarding and
This OCD, doctor, this OCD can come as insomnia.
Doctor, OCD come as insomnia, but that will be in severe cases, doctor.
Okay.
Okay, so
Doctor, what is the name of this condition in which the patient cannot discard these things? What is the name of the condition?
hoarding, HOARDING, hoarding disorder.
Holding. Okay, holding. Okay.
Hoarding, HORRD. Okay, so here patient will be saying that keep on. There was one case, doctor, arise. If I'm not mistaken, 20 or 2021 something was there. Patient say that she is keep on going to the street. Mother is keep on going to the streets and collecting the bags, plastic bags. You understand what I mean? She's very rich person, okay, and she's going and collecting the bag from that streets. Okay, do you think this is OCD or something?
Can be.
No.
Dr. Imran, that
No,
all
doctor.
comes under the heading of OCD.
Yeah,
It
it's come
can be hoarding
all
disorder. No,
a
hoarding
hoarding disorder, yes,
disorder.
No.
doctor. And yes,
Hoarding.
one
It can be
yeah,
hoarding disorder. Yes.
hoarding disorder, yes, doctor. Hoarding disorder comes in the category of a few things. Let me tell you, doctor. excess clutter in the home. Okay, patient will be thinking about home and room, difficulty using spaces. He will be feeling difficulty. I might have some problem, or he is not going to share. Strong attachment to the possessions, or even objectively, maybe he's collecting the newspaper, packaging, broken objects. He don't want to leave because he is having some strong emotions. Avoidance of making decisions and about discarding. I don't want to because he wanted to keep. Room is totally untidy. Family conflict will be there, okay? And social isolation. Relative will be distress. He will be, even though landlord also will be problematic because this fellow is quite dirty and fellow, he's not taking care of the things. Okay. Here, there will be a risk. Okay. Because piling up of the unusual things might increase the fire hazard. Okay. False, maybe he piled up bricks in the home, might fall down on him. Poor hygiene and infestation and self-neglect. Doctor, this kind of patient, this kind of cases comes with different things. Like say, many time candidate found difficult because they found that patient having depression and anxiety disorder along with hoarding disorder. Sometimes patient come with OCD and this problem, and sometime mother come, doctor, my child having habit of taking the pen from other children and he's bringing it in his bag and collecting. He don't want to give away. Then we have to think about autism or ADHD, and personality difficulties are there. Okay, because patient wanted to keep 2 or 3 pocket in his then and everything is in his pockets, huh? And cognitive impairment in the older adults. Okay, now how we are going to distinguish from OCD and hoarding disorder? Okay, in OCD, the hoarding may be driven by the specific obsession, like say, for example, doctor, patient having fear from harm if something is discarded, and usually dystonic. Okay, patient will be having, doctor, this we are taking, I will die because of that one. In hoarding disorder, how there is a generalized difficulty discarding. Okay, often syntonic. Okay, or with limited insight and no clear compulsive ritual or reduce anxiety. In OCD, doctor will be having fear. Here, patient don't have the fear. Here, patient having difficulty to discard the thing. Okay, in OCD, patient having fear. If I am discarding this thing, it will harmful for me. If I'm discarding this thing, this maybe some religious part is the thing is there. I'm discarding, God will punish me. Huh? So here, how you're going to assess the point in GP setting? This is very typical. Is an unusual but unique case might arise in the exam. So we have to go in a way because anything can happen in the exam, doctor. So history, how going to take the history? Okay, we have to see in hoarding disorder, patient onset and course. Okay, mostly patients start. This is start in adolescent. Patient is elderly. He started going to university, and after that he started. It progresses with the age. It increase. Okay, and types of items saved. Okay, amount of clutter, impact on use of rooms. Okay. Any previous clear out attempt or emotional response? Maybe, doctor, I went to, I throw this thing happened to me. So I don't want to make it again happen. So then we are going to see the patient function and risk. Okay. Can they use the kitchen or bathroom or bed safety? Okay. Is there any risk of fall or fire or blocked exit because of piles of newspapers in the room? Or infestations are there? Maybe he's collecting something which is making smell. And food spoilage. Maybe he's collecting the food because war is going on. And war happened 15 years ago, still having the fear of war. Okay, self-neglect and nutrition and personal care. Then what we are going to look into the patient? It is a mental state and comorbidities. We are going to screen the patient for the depression, anxiety, psychosis, OCD, alcohol or substance abuse. In elderly patient, like say we call it older adults, we have to consider cognitive assessment if concerns about dementia. Like say age more than 75, I'm coming, I'm as SP, I'm saying that my father having this thing. He's collecting that, as I've given you example of 2021 or 22, that my mother is collecting the bags from the streets. Okay. Then capacity and safeguarding. Okay, so how, if we have to see that how much is the capacity of the regarding the decision about home and possessions, and particularly if there is a risk. Okay, impact on the dependents, other people, how they are getting impacted, how they are getting impact, how the child is, because I am the child, my mother is doing this thing. Okay, so I am very fussy, doctor. Doctor, what to do? My mother is keep on piling these bags. It's very smelly and dirty. Being a child, it is impacting my life. Okay, vulnerable adults. If I wanted to remove my doctor, my mother is beating me. Okay, and what about the pets? If there is any pet, and possible need of safeguarding referral, we call it multi-agency working social, like the social care, okay, housing or fire services. Why is that? I'm going to involve multidisciplinary. Okay, so doctor, management always start from psycho education to engagement and psychological intervention and pharmacological treatment. Then risk management with multi-agency work. Okay, always first line is a CBT, tailored to holding. That I have to say that, tailored to holding. Okay, they will be doing home sessions, skills for ongoing, skills for organizing, decision making, and discarding the things. Exposure to hear what was the agenda, because here this session will not be happening at the clinic. This will be happening at the home. The reason where that pile up is there. Okay, then we are going to access and availability vary. Because it is in our practice, we might refer through some sort of services like say mental brain specialist or my specialist or some sort of geriatric team or whatever so on. But pharmacological doctor, there is a limited evidence. Mostly, we will be going to psychological intervention rather than pharmacological. SSRI might be beneficial, but we will not be considering as a treatment. Okay, so I will not suggest this thing. But still, we have to examiner just still wanted to know about your psychological interventions rather than going to these things. Okay, so this is the one. And one doctor asked about dermatillomania. Okay, where patient will be having recurrent picking of the skin that lead to skin lesions, biting the lips when the stress. Okay, and biting repetitive attempts to stop and reduce at the picking. Patient will be having, he tried him or herself, but still biting because now nails are keep on bleeding. Patient will be clinically having significant stress and functional impairment will be there. Okay, so there are many things are there. It will be a little bit longer, but if you guys want, I can take the session on that one. But again, doctor, OCD having four parts. Please take care of that one because this is not a simple thing. OCD hand washing technique is there. No, body dysmorphic disorders are there. No, doctor, there are three other parts are there. So we have to talk about, we have to think about, and how we are going to deal it. And doctor, I have one last case. Anyone want to do?
Doctor, I want to do
Doctor.
it.
Okay, Dr. Raj. There is a case. Yeah, Mr. Imtiaz, he's a 40 years old, 40 years old gentleman. He come to discuss his problem with you, take history and manage the patient. Examination is not required.
Doctor, it's a Mr. Imtiaz.
Yeah, age 40.
Okay. Shall I
Okay,
start?
Start.
Hello, Mr. Imtiaz. Good morning. I'm Dr. Raj. How may I help you?
Doctor, since the last my accident, I keep seeing it again and again in my head, doctor. It really, I can't wash it away from my brain.
I can understand, Mr. Imtiaz. It must be very difficult time you're going through it. But Mr. Imtiaz, let me assure you, whatever you speak will remain confidential. You can speak freely with me. Okay, Mr. Imtiaz?
Sure, doctor.
Okay. So may I ask you, can you please tell me more about it?
Doctor, I was having car accident 6 months ago. I survived, but another person
Mhm.
in the car was died, unfortunately died.
Mhm.
Doctor says
Okay.
then I feel like experiencing that these vivid flashbacks. I'm having
Mhm.
nightmares. Every week, 3 to 4 times, I'm getting this nightmare that I'm in the on the same car in the same car and I'm hitting other people. I'm killing other people. Doctor.
I can understand, Mr. Imtiaz. Must be a very difficult time we gone. Mr. Imtiaz, I want to ask you a few more questions related to health. Is that okay with you?
No, doctor.
Okay. May I ask you, since how long have you been experiencing these symptoms?
Doctor, this is I met the accident last 6 months now.
Since 6 months now. Okay. So I want to ask you that do you experience that night, the things that you experience the things which are not in real? Are you experiencing these things?
No, doctor.
Okay. Are you avoiding the places which you go before?
Yes, doctor.
Mm-hmm. So are you avoiding the talk uh, about the experience that you have gone through?
Yes, doctor.
I can understand. So do you have any low mood for past 2 weeks?
Yes, doctor. I'm having guilt. I feel that low in mood
Mm-hmm. So do you have
about
lost interest in
surviving.
favorite activity?
Sorry, doctor.
Sorry. Uh, so I want to ask you, do you have lost interest in favorite activities that you were doing before?
Doctor, I don't want to go outside because I keep on thinking these
Mm-hmm.
things.
How about your appetite, Mr. Imtiaz?
Well, doctor, appetite is reduced now.
And what about your sleep?
Doctor, it's really difficult. If I'm getting sleep, I can't sleep much. I have, poor sleep.
Mr. Imtiaz, may I ask you that you have tried to harm yourself in any way?
No, doctor.
Mm-hmm. Do you have any problem in concentration of memory so far?
Doctor, I have poor concentration. I can't concentrate.
Mm-hmm. Okay. Mr. Imtiaz, so I want to ask you that do you feel that something will going back will happen to you? You worry most of the time.
No, no, doctor. I'm just worried about that accident only, doctor.
Are you able to cope up with that feelings which is going on with you?
I'm trying to cope, doctor.
Mm-hmm. Okay. So any past medical history of a long-term illness, Mr. Imtiaz,
No,
you'll have
doctor.
any family history of a long-term illness?
No, doctor.
And what do you do for a living?
I'm a taxi driver, doctor.
And how's everything at work while arriving?
I, c- since I met the accident, I'm unable to drive, doctor. I'm having
Mm-hmm.
financial stress going on, doctor.
I can understand very well, Mr. Imtiaz. Mr. Imtiaz, so whom do you live with?
I'm living with my wife, doctor.
Mm-hmm. And how's everything at home?
Doctor, everything is stressful, doctor. I have to pay fees my child. I have to pay my
Mm-hmm.
rent.
Understand this thing very well. Okay, Mr. Imtiaz, so do you feel any fatigueness?
Doctor, I feel tired, exhausted, doctor.
Mm-hmm. So how about your relationship with your wife?
Doctor, it's not good because I
Mm-hmm.
can't pay the rent and other thing. My child is not going to school.
Mm-hmm. Okay. Mr. Imtiaz, may I ask you that do you smoke?
No, doctor.
Do you consume alcohol?
No, doctor.
Do you take any recreational drug for enjoying?
No, doctor.
May I ask you that is the exercise is a part of your life?
No, doctor.
And what about your BMI, which is weight according to height?
I never checked, doctor.
Mm-hmm. I can understand. So, Mr. Imtiaz, may I ask you that how has been impacting your daily life about this going on with you?
Doctor, it's really bad, doctor. As I told you that I can't work, so I'm a bit in
Mm-hmm.
financial trouble, doctor.
Mm-hmm. I can understand. So, Mr. Imtiaz, may I ask you that what's worrying you most?
Well, doctor, I am worried that if it is not solved, then I will not be able to drive. Whether I will be able to sleep again properly or not. Whether I will be
Mm-hmm.
able to support my family again or not.
I can understand, Mr. Imtiaz. Mr. Imtiaz, so what do you expect from today's consultation?
Doctor, just can you tell me something that I can do it and I can overcome with my problems, doctor?
I can understand, Mr. Imtiaz. Mr. Imtiaz, I will let you know everything in the consultation. Before that, I want to summarize what we have discussed so far. So you
Mm-hmm.
have faced this car accident event 6 months back, and that's make a lot of trouble for you, having a financial issues, unable to drive, and you are thinking about the sleep problem as well,
Mm-hmm.
unable to pay the fees, and you want to discuss some treatment management plan. Is that okay?
Yes, doctor.
Okay, Mr. Imtiaz, as per history, what you have told to me, it looked like the most probable condition you have gone through is called post-traumatic stress disorder. Do you have any idea about it?
No, what is this, doctor?
Okay, Mr. Imtiaz, it's a condition in which basically the person who has faced this problem, this condition, is keep on having a lot of dreams, a lot of visual that the similar attacks has been again can happen. So are you able to understand this thing?
I'm getting, doctor.
Okay, so Mr. Imtiaz, there are two ways to handle this situation, which is first of all is the pharmacological and one is the non-pharmacological. Whichever you want to discuss with me.
Doctor, which is feasible for me?
Mr. Imtiaz, so shall we discuss with the non-pharmacological initially? So, Mr.
Uh,
Imtiaz, I can understand you have a lot of trouble going on with your sleep and having a problem with your wife as well. So, how is it possible with you that you can have a good time, like maintain a time in the night by 9 p.m. you can sleep, and daily time you can take a nap in that time? Is that okay with you? Try to have a
Doctor, I
lot of
can't
curtains.
sleep. Doctor, I can't sleep, doctor.
Just make sure that you can take all the phone gadgets or keep them sideways and put the all curtains in the night time, put the dim light and try to cope up to sleep. Is that okay if you can manage that?
Okay, doctor.
Okay, Mr. Imtiaz, first of all, the sleep is the most concerned thing that you have asked me. So this is the only way we can cope up with the sleep. Meanwhile, we can also suggest you to have a healthy diet, take some time, go out with the family, friends, discuss about this thing. This is the main issue. If you don't discuss this issue, this won't be gone away. Okay, so you
So
can
you mean
try
to
to
say, doctor,
discuss
I have to
with your
discuss
friends.
this problem with my friends?
You can discuss this problem who are very close to you. Discuss with this problem like that. This has been going on with me a lot of time, and I'm not coping up with them. Might be they possible they can give you some supporting advices that you can able to accept that. Is that okay with you? Can you
Okay,
manage that
doctor.
with?
Okay, doctor.
I want to engage you with one therapy which is called cognitive behavioral therapy. It's a therapy basically which there's a knowledgeable person sitting in front of you, will take out some negative thoughts from you and giving you positive thoughts. And this is
Hmm.
basically 8 to 12 session that can go on with one weekly. So this will definitely going to help you out in managing this situation. Is it okay with you? You can go with this.
Okay, doctor.
And there's one more thing I want to discuss with you. This is called the EMDR, basically, which is the eye movement desensitization and reprocessing technique, which is the technique in which the visual which are you going through, they will show you in front of you, and you have to face this regular basis. And by that, slowly, gradually, you will take out from that event, and you will accept that situation that is everything is gone, and now you have to move on with the life. Is that okay with you?
Okay,
Can you
okay,
manage that?
doctor. Okay,
Okay,
doctor.
so Mr. Imtiaz, I would like to give you one medication which is called sertraline. If this sedative is not work, then I will going to prescribe you this medication, sertraline 50 milligram OD. You can take this. Okay.
Hmm.
Mhm.
Okay,
And
doctor.
meanwhile, try to do take a have a healthy lifestyle mode. Go for exercise. Listen the
Hmm.
music. Whatever is convenient with you, you can
Okay,
do this.
doctor.
Okay. Okay,
Hmm.
and don't just try to avoid these all thoughts which are coming to you by solving with discussing with your family friends and involve your wife as well. If it has a
Okay,
problem, I
doctor.
can understand it has a lot of trouble with you with your wife. Just make
Hmm.
sure give her in a loop. Just try to discuss with her. If it is not be possible for you, you can bring her next time to me if it's convenient with you, so I can discuss with her in front of you about the problem. Might be the possible solution can come out.
Okay, doctor.
Okay, so I will give my number to you. If you have any problem, like you want to harm yourself or you are facing a lot of problem, so we can discuss this problem anyhow. Is that okay?
Okay, okay, doctor.
Okay. By giving you this medication, the Sertraline, you had in 2 weeks, you can have a problem of suicidal ideation. You'll have a
Time
problem
up,
of
Dr.
suicide.
Raj.
Okay.
Well done, Dr. Raj. Wonderful. I must say that you have good grip on this, but you have to change few things in your data gathering and consultation, which is not related to your knowledge, which is related to your practice. Am I right?
Okay.
Here you say that I wanted to do, I will do. No. Shall we discuss? May I discuss in a
Okay.
requesting way rather than ordering way?
Mhm.
Okay, you have to practice this thing. That may I discuss? May I help you? May I help you to get this thing? May I go through this thing? And one of the best thing you have done, you talk about CBT and EMDR. Okay,
Mhm.
and I wanted to listen EMDR about that one. That was wonderful. But now I have one question. When you are going to refer this patient?
First of all, if there is suicidal ideations, I found
Mm-hmm.
it out, suicidal harm,
Mm-hmm.
or the
Mm-hmm.
patient feels like that there's the life is not worthful for him. He will have a guilt
Mm-hmm.
about this, that he has made possible that he has done some accident or he faced some accident like that. So
Mm-hmm.
in such a situation, I would like to refer.
Okay.
Hmm.
Okay. Then, doctor, for example, I'm giving one more scenario in this case. This is a
Hmm.
what PTSD, one of the most common discussed on many platforms, many platforms. Okay. But sometimes patient can come with chronic childhood abuse.
Hmm.
What you will do?
Child abuse.
Yeah, chronic childhood abuse. Means patient is now elderly,
In
but still
that
in his
way, we
patient is
have to
a
refer. In that way, we have to
yes,
refer to the child care services as well. We have to involve all these services in
yes.
that situation.
And what else?
And lawful
Doctor, I am the
law
one
enforcement
patient. I am the
agency
one
as well.
patient. Doctor, I'm taking this medication. I went for a talk therapy. My talk therapy failed. Doctor, can you suggest me
Hmm.
something different? What you do?
If the talk therapy fail,
Hmm.
then there's a treatment which is called paroxetine or sertraline, which can be available, which can
Okay,
we
if
give.
this fail,
And if that fail, then we have to give the, if the sleep problem is going on, then we can give the
Failure of treatment, we have to refer doctor, right? Failure of
yes,
treatment.
failure to
We
the
have to
treatment is
refer.
refer. Refer,
Failure of
doctor. Third
treatment
line is
always.
Peter. Second line is second line. After second line, there is no third line for us. Third line is referral.
okay.
Yes, doctor. Okay. Well done, doctor. And in nutshell, for everyone, I'm going to tell that whole story, what we have gone through. We have done the cases so far from panic disorder, PTSD, and so many cases we have discussed. But always remember, sometimes you will not be getting straight away case. Sometimes you will be getting simple, case, but look like very complex. The reason because how you going to deal with that one. Like a dysmorphic disorder in my exam, patient want glutathione injection. What you do? Difficult. Nothing. You cannot do anything. Means like say, patient was, keep on, seducing you actually. Being a male doctor is very difficult for us to deal with that one. I'll tell you, this kind of body dysmorphic disorder, if patient is a male or female, they will keep on seduce you. Please make sure that you should not get distracted. Mark my word, doctor, on the record, I'm telling you guys. Because these are the agendas are there where you're going to see. Patient was sitting with full overcoat in front of me. When I sit, she removed her coat and she was having maxi. She was sitting in front of me, and she started correcting her, posture and other things, and she was keep on changing the position. That was a difficult part for me because she want glutathione injection. When I asked about patient profession, other thing, then we have to start about CBT and whatever so on. But important again, always psychiatric cases definitely they will be keep on seducing you. Please make sure that you should not distract. And many of our friends, they are getting this problem and they go off the track. Okay. Second thing, doctor, post-traumatic disorder. Simple way, patient will be presenting with that one. What are the characteristic features are there? We call it hyperarousal. This is the important thing. Avoidance of situations and activities, and re-experiencing and distress. These are the four. We call it hard. This mnemonic is the hard. H for hyperarousal, A for avoidance of situations or activities, R for re-experiencing the traumatic events. Vivid, intrusive memories or flashbacks or nightmares are there. Okay, or distress like a strong or overwhelming fear or physical sensations where when they are re-experiencing. Management is pretty simple, doctor. Trauma focused CBT, eye movement, desensitization and reprocessing EMDR therapy, and pharmacological we call it SSRI or SNRI based on patient condition, and plus psychoeducation, sleep hygiene and relaxation, etc., as Dr. Raj mentioned. So one. Number two, doctor, complex cases like say, as I told you that patient having childhood abuse case. Okay, case can arise to you. A very complex case. Here, it is not something that it is a very simple case I'm going to deal with. No, no, no. It's not a difficult. Here, patient having, the characteristic features are very difficult. Okay, patient will be having prolonged or repetitive situations. Okay, from which he escape is which is difficult, like say torture, slavery, genocide. Okay, genocide campaigns are there. Prolonged domestic violence is there. Repeated childhood sexual or physical abuse. Okay. So, this complex post-traumatic stress disorder can be thought as a constellation of significant modifications to a person's automatic threat response. Okay, because patient already adopted this prolonged repeated trauma. How are you going to deal with that one? This kind of trauma, doctor, can lead to patient brain, especially vulnerable to subsequent traumatic experiences later in the life. Patient will be facing this problem throughout the life with many similarities. Okay, from emotionally unstable personality disorder, we call it EUPD, also comes in that complex post-traumatic disorder. Okay, and this characteristic will be featuring as severe or persistent problems in affected regulation, regulation, and severe and persistent slow self-worth accompanied by feeling of the shame or guilt or failure related to the traumatic events, and severe and persistent difficulty in sustaining the relationships and feeling close to others. Scenario I'm giving you, doctor. Patient got child abuse. Sorry, doctors, this bit sensitive topic I'm telling you. Um, Patient come to you, doctor, I'm going to getting married about 1 month. But I am not a virgin. But I never been active. But I got child abuse. But she was not telling you that she got the child abuse. You have to be very sympathetic. And as Dr. Raj told that whatever you discuss, it will be confidential between you and me. So you have to tell the patient, then patient will open up to you. Okay, then you have to see this kind of patient need same treatment as a PTSD, but patient need a more long-term psychological therapy. But we are going to refer this patient to the specialist. We are not going to deal this patient. Okay, doctor. Now, OCD, we talked about OCD disorders. They are having 5 patterns are there. We already gone through. Then case come with anxiety and medical students, doctor. I'm a medical student, doctor. I'm very much tired, exhausted because I don't understand anatomy or biochem or physiology, or I don't like pharmacology or pharma classes. So I have to think about how to deal with that one. Okay. So please make sure that you have to act as per the case to case rather than that one. Okay. So let me tell you what are the resources I have gone through. This one I gone through Royal College of Psychiatrists and Anxiety and Panic Disorders and Phobias, and there was a one article on mind anxiety and panic attacks and other mixed disorders are there. So I have gone through these articles and resources. Then I come out to this conclusion. Okay. So doctors, please.
Dr.
Practice
Imran?
more and more. Yes, Dr. Farid.
Dr. Imran, how can a case of adjustment disorder comes in exam?
Doctor, that is next session. We will be talking about
Okay.
adjustment disorders also, and anxiety. Sorry, what you call it? Detachment disorder, adjustment disorder. These are all we will be talking on that one, doctor. We have a different session on that one. Okay, so doctor, I hope so you gone through and you got the idea. Still, you guys have questions, queries, please feel free to open up in the WhatsApp group. So I will be answering over there whenever I'm getting time. Okay. So thank you very much, doctor. See you tomorrow, some different time. Thank you, doctors.